C-suite conversations around aging caregiving. Family traditions change. Relationships shift as children become more like the parent as aging parents require more care. Executives who are family caregivers themselves have two problems to solve. They face the stress of being a family caregiver for a loved one. Plus, they are responsible for ensuring the stability of a workforce threatened significantly by the caregiver crisis. The Washington Post reports that caregiver demands are now so high that they have become the #2 reason after retirement why someone exits the workforce. Since 80% of caregivers have a paid job, it is necessary to help employees manage this juggling act. Jeanette Galvanek, founder and CEO of CareWise Solutions, says, "It is not okay to accept national employee burnout as a natural state of being. We cannot allow business investments attracting and developing teams to be lost or redeployed. Organizations can bring care management to work. Managers must be equipped with the skills and resources to actively support people in this care and work collision. Ultimately, C-suite executives must agree to do everything possible to reduce the exhaustion and unfair burdens permeating their businesses." It's time for business leaders to say, employees are not free healthcare workers. Instead, they need to be caring family members. Here are some curated ideas from executive brainstorming sessions. Create additional acceptance in the workplace of the caregiving crisis and its impact on everyone. Build communication channels within the organization and send the message that it is okay to ask for help and support. Pay attention to the disparate impact of caregiving on lower wage earners and people of color. This goes beyond diversity into equity principles, like the right to work and have family responsibilities in America. Organize an anonymous survey to determine the number of caregivers and the extent of the issue in the organization. Invest in the ability of employees to manage immediate short-term issues. Then continue to implement longer-term solutions. Offer a complete solution such as the Caring Place Hub with CareWise Solutions education and training as a part of the fabric of the business, going beyond wellness programs and EAP. Employees have the right to care about, not for their aging family members in healthcare-type roles. Employers have the right to maintain their workforce. Americans, employers, and employees alike are asking why there isn't a driven, directed leadership effort to put the home and community care professionals needed in place. The nation wants to know where the necessary changes in employee benefits and private insurance policies are. Employees are additionally burdened by picking up out-of-pocket expenses of over $7,000 a year for each aging family member. CareWise Solutions is asking for significantly increased capabilities of all healthcare workers and care economy employees to raise awareness of the work and care collision. It's time to change the assignments given to family caregivers in all circumstances. This includes transitions from healthcare to home. We need to provide adequate support when a patient has a working caregiver or doesn't have one at all. The caregiving crisis is now accepted as a national, even global issue. Everyone must come together to create the highest level policy changes that could truly impact the lives of family caregivers, their employers, and their aging family members. But it hasn't happened yet. In the meantime, CareWise Solutions offers the only comprehensive solution for employees and employers to move forward, take charge, and feel empowered to competently manage the care system we all need. Organizational next steps. Draft a document to describe the desired state for your employment brand. Share it with your leadership team and ask for feedback. Ultimately, build a statement that can become part of the organizational mission statement. National and global changes will take time, so act to make the differences you can for yourself and your employees now. Contact CareWise Solutions when your organization is ready to take the next steps toward building a comprehensive solution for the caregiving crisis.